7 dangerous morning signs of diabetes you should never ignore. Do you ever wake up feeling exhausted no matter how long you sleep? Your body might be screaming something you need to hear. Every morning, millions of people experience warning signs of diabetes without realizing it. These silent alarms often go unnoticed until more serious complications develop. What you dismiss as normal aging could actually be your body trying desperately to tell you something's wrong. Today I'm breaking down the 7 most dangerous morning signs of diabetes that medical professionals want you to recognize before it's too late. Diabetes affects over 37 million Americans. That's roughly 1 in 10 people, and shockingly, 1 in 5 don't even know they have it. This silent disease progresses quietly in the background while damaging vital organs throughout your body. The good news? Catching these warning signs early can literally add years to your life. Let's dive into what happens inside your body when diabetes begins to develop. When you eat, your body converts food into glucose, essentially fuel for your cells. But to use this fuel, your cells need insulin, a hormone produced by your pancreas. Think of insulin as the key that unlocks your cells so glucose can enter and provide energy. With diabetes, this system breaks down in one of 2 ways. In type 1 diabetes, your body simply doesn't produce insulin. In type 2 diabetes, which accounts for about 95% of all cases, your body either doesn't make enough insulin or your cells have become resistant to it, like changing the locks so the keys don't tear. When this happens, glucose builds up in your bloodstream instead of feeding your cells. This creates both immediate symptoms and, over time, serious damage to blood vessels, nerves, and organs throughout your body. The morning is particularly revealing because after hours without food, your body's regulatory systems are most visible. Let's start with the first dangerous morning sign: extreme thirst upon waking. Do you find yourself desperately reaching for water the moment you open your eyes? While hydration is important, waking up with an unquenchable thirst isn't normal. When excess glucose builds up in your bloodstream, your kidneys work overtime to filter and absorb it. When they can't keep up, this excess glucose is excreted into your urine, dragging along fluids from your tissues. This makes you urinate more frequently and leaves you feeling dehydrated. Think about it: if you're constantly getting up throughout the night to use the bathroom, you're losing fluids. By morning, your body is sending urgent signals for replenishment. This isn't just ordinary thirst. People with untreated diabetes often describe it as a desperate, almost painful need for fluids that no amount of water seems to satisfy. Sarah, a 42-year-old teacher I spoke with, described it perfectly. "I thought I was just sleeping with my mouth open, but I was drinking nearly a gallon of water every night and still waking up feeling like I'd been in the desert for days. My doctor later told me my blood sugar had been elevated for months." The second warning sign ties directly to this: frequent urination, particularly overnight. Most healthy adults can sleep 6 to 8 hours without needing to use the bathroom. If you're consistently waking up multiple times to urinate, your body might be trying to flush excess glucose from your system. This process, called polyuria, occurs when your kidneys can't reabsorb the glucose filtering through them. The glucose creates an osmotic effect, pulling water into your urine. The more glucose in your blood, the more water gets pulled along with it, and the more often you need to go. Not only does this disrupt your sleep, leading to fatigue we'll discuss shortly, but it creates a vicious cycle of dehydration and thirst. Many people dismiss this symptom, assuming it's just a sign of aging or drinking too much before bed. However, if you've reduced evening fluids and still find yourself making multiple bathroom trips overnight, it's worth discussing with your doctor. The third morning warning sign is dry mouth and bad breath. Morning breath is common for everyone, but the dry mouth associated with untreated diabetes is different. People often describe it as feeling like they've been chewing on cotton balls all night. This happens for 2 reasons: the dehydration we've already discussed and something called ketosis. When your body can't use glucose properly, it begins breaking down fat for energy instead. This process releases acidic chemicals called ketones, which can build up in your blood and create a distinctive fruity or acetone-like smell on your breath. Some describe it as smelling like nail polish remover. Overripe fruit. James, a diabetes educator I interviewed, explained, "When patients tell me they wake up with a mouth so dry that their tongue sticks to the roof of their mouth, and family members comment on their unusual breath odor, those are red flags I never ignore." The fourth warning sign, and one of the most commonly reported, is unusual fatigue upon waking. We all have mornings when we'd rather hit snooze, but diabetes-related fatigue is different. This isn't just feeling sleepy, it's a profound exhaustion that doesn't match your sleep duration and doesn't improve with rest. When your cells can't access glucose for energy, it's like having a full tank of gas but a broken fuel line your body's engine can't run efficiently. Additionally, the frequent nighttime urination we discussed earlier fragments your sleep, preventing you from reaching the deeper, restorative sleep phases your body needs. Many people with undiagnosed diabetes report feeling like they haven't slept at all, despite spending a full 8 hours in bed. This morning exhaustion often forces people to rely heavily on caffeine just to function, masking an important warning sign in the process. The fifth morning sign is particularly alarming: blurred vision upon waking. Many people report reaching for their glasses first thing in the morning when they never needed them before. This happens because high blood sugar affects fluid levels in your tissues, including the lenses of your eyes. When blood sugar is elevated, the lenses can swell, changing their shape and affecting their ability to focus light correctly on your retina. This typically improves as the day progresses and you become more active, which is why many people don't connect it to a potential health problem. Dr. Lakshmi Patel, an ophthalmologist specializing in diabetic eye care, explains, "The morning vision changes with diabetes are subtle at first. Patients describe it as looking through a smudged window underwater. What's concerning is that by the time someone notices this, they've likely had elevated blood sugar for some time. Even more concerning is that untreated diabetes remains the leading cause of blindness in working-age adults in America. The blood vessel damage that begins with these morning vision changes can progress to serious conditions like diabetic retinopathy if left unchecked." Our sixth warning sign is morning headaches or dizziness. Waking up with a pounding head or feeling lightheaded when you stand up can be your body's response to several diabetes-related issues: dehydration, fluctuating blood sugar levels, or poor sleep quality. Overnight, your blood sugar can drop too low if you haven't eaten for many hours. This triggers your body to release stress hormones that can cause headaches. Alternatively, very high blood sugar can lead to dehydration that triggers headaches and dizziness upon standing. These morning headaches often have a distinctive quality. They tend to improve after eating breakfast, which temporarily stabilizes blood sugar levels. If you notice this pattern, particularly in combination with other symptoms we've discussed, it warrants medical attention. The seventh and final morning warning sign is tingling or numbness in your hands and feet. This condition, called diabetic neuropathy, develops gradually as elevated blood sugar damages nerves throughout your body. Many people report that this tingling sensation is most noticeable when they first wake up. The reason? When you're still, fluid can accumulate in your extremities, putting pressure on already damaged nerves. The result is that pins and needles sensation, or even complete numbness, that gradually improves as you become active and circulation increases. Michael, a 58-year-old construction worker, shared, "I thought I was just sleeping in a bad position, but every morning both my hands would be so numb I couldn't button my shirt. My doctor found my blood sugar was nearly 3 times the normal level." This nerve damage begins subtly but can progress to permanent loss of sensation. When people lose feeling in their extremities, injuries can go unnoticed, sometimes leading to serious infections or even amputations in severe cases. Now, Let's talk about what makes these morning symptoms particularly dangerous. First, they're easy to rationalize away. Feeling tired? Must be stress. Thirsty? Maybe the bedroom is too dry. Headache? Probably need more coffee. This tendency to normalize symptoms delays diagnosis and treatment. Second, these warning signs often appear together, creating a compounding effect that severely impacts quality of life. Imagine waking up exhausted from fragmented sleep, rushing to the bathroom, dealing with blurry vision and a pounding headache, all while feeling like no amount of water can quench your thirst. This isn't just inconvenient, it's your body in distress. Third, and most importantly, these symptoms indicate that damage is already occurring within your body. Diabetes affects virtually every system: your circulatory system, nervous system, immune system, and more. By the time symptoms become noticeable, some degree of damage has already happened. Dr. Robert Gabbay, Chief Scientific and Medical Officer for the American Diabetes Association, emphasizes, "The tragedy is that type 2 diabetes is largely preventable, and its complications are largely preventable. Early diagnosis makes an enormous difference in long-term outcomes." Let's look at the physiology behind these symptoms to understand why morning is such a revealing time for detecting diabetes. During sleep, several important processes occur that can unmask blood sugar problems. First, your body follows natural hormonal rhythms. In the early morning hours, your body normally releases growth hormone, cortisol, and other hormones that naturally raise blood sugar to prepare you for waking. In people without diabetes, the pancreas simply releases more insulin to handle this dawn phenomenon. But if you have developing diabetes, this normal morning blood sugar rise can push you over the threshold where symptoms become apparent. Second, the fasting period overnight creates a clearer picture of how your body handles glucose. Without the confounding factor of recent food intake, morning blood sugar readings provide doctors with valuable diagnostic information. Third, while you sleep, your brain carefully monitors your body's internal environment. If something is amiss, like unstable blood sugar, your brain may trigger survival mechanisms that fragment sleep and generate symptoms like the morning headaches we discussed. Now that we understand the warning signs, let's address the challenge many people face: actually connecting these symptoms to diabetes. The truth is, most people with early diabetes don't immediately think I might have diabetes when experiencing these symptoms. Instead, they attribute them to aging, stress, poor sleep habits, or other lifestyle factors. Even healthcare providers can sometimes miss these connections if patients don't report all their symptoms together. That's why it's crucial to track patterns rather than isolated incidents. One morning of excessive thirst might be nothing to worry about, but if you notice it consistently over weeks, along with other symptoms we've discussed, that pattern becomes medically significant. Mark, a patient diagnosed with diabetes at age 47, shared, "For months, I blamed my exhaustion on my stressful job, the dry mouth on sleeping with a fan on, and the frequent urination on blood pressure medication. I mentioned them separately to my doctor over several visits before he finally ordered comprehensive blood work that revealed my diabetes." This brings us to another critical challenge: the tendency toward denial. Many people suspect something might be wrong but avoid seeking medical care out of fear of receiving bad news. This fear response is understandable but potentially dangerous when it comes to diabetes. Undiagnosed diabetes doesn't remain static, it progresses, often silently damaging your cardiovascular system, kidneys, eyes, and nerves. Let's explore what happens if these morning warning signs go unaddressed. The short-term consequences include declining energy, mood disturbances, reduced productivity, and diminished quality of life. The long-term consequences are far more serious. Heart disease risk increases dramatically. Kidney function can deteriorate, leading to possible dialysis, vision problems can progress to blindness. The good news? Type 2 diabetes, which accounts for most cases, responds remarkably well to early intervention. Studies consistently show that lifestyle modifications, including modest weight loss, regular physical activity, and dietary changes, can significantly improve insulin sensitivity and sometimes even reverse early type 2 diabetes. Dr. Emily Chen, an endocrinologist specializing in diabetes care, explains, "When patients come to me having recognized these early morning symptoms, we have many more options. We can often start with lifestyle modifications and careful monitoring rather than immediate medication. The earlier we intervene, the better chance we have of preventing serious complications." So what should you do if you recognize these morning warning signs in yourself or a loved one? First, don't panic, but don't ignore them either. Start by documenting your symptoms when they occur, their severity, and what seems to make them better or worse. Second, schedule an appointment with your healthcare provider specifically to discuss these concerns. Ask for comprehensive blood work including fasting blood glucose and hemoglobin A1C, which shows your average blood sugar levels over the past 3 months. Third, begin making gentle lifestyle modifications while waiting for your appointment. Increase your physical activity, reduce simple carbohydrate intake, ensure adequate hydration, and prioritize sleep quality. These changes benefit overall health regardless of diagnosis and may help alleviate some symptoms. Remember that diabetes diagnoses exist on a spectrum. Before developing full-blown type 2 diabetes, many people pass through a stage called prediabetes, where blood sugar is elevated but not yet in the diabetic range. Approximately 96 million American adults, more than 1 in 3 have prediabetes, and more than 80% don't know they have it. Catching diabetes at this early stage provides the greatest opportunity for reversal. Jennifer, who identified her prediabetes through morning symptoms, shared, "The excessive thirst and fatigue were my wake-up calls. My doctor found I had prediabetes, and within 6 months of changing my diet and walking daily, my blood sugar normalized. Those uncomfortable mornings literally saved my health." For those already living with diabetes, recognizing these morning symptoms can serve another important purpose. They may indicate that your current management approach needs adjustment. If you're experiencing these warning signs despite treatment, it's a signal to connect with your healthcare team promptly. If this video helped you understand these warning signs, hit subscribe to learn about other health signals your body might be sending.